Hello everyone, Dr. Mark here, and today I wanted to make a video about one of my Ask a Vet questions. This type of treatment alternative may be effective for more than breast cancer in dogs, but we are still learning a lot about it. In this video I am including a dose chart on how much you need to give and directions on where you can buy Ivermectin without a prescription. Should I treat my old dog for cancer? My dog has breast cancer, and I do not want to watch her have surgery at her age nor suffer with chemotherapy in the few months she has left. A guy at the dog show was telling me about this new cancer medication that used to be sold as a dewormer. Is Ivermectin really an alternative to treat her cancer? Gina. Does Ivermectin help with mammary cancer? Yes, Ivermectin has been shown to work to treat mammary cancer in dogs. There are several good alternative treatments for cancer, and as you already know, some of the newest treatments available use dewormers with success. Diet is also important, as a low-carbohydrate diet does not support the tumor growth. How does Ivermectin work on tumors? Mammary gland cancer is the most common tumor in intact female dogs, and figuring out how to handle it in a senior dog is sometimes a problem. Conventional therapy involves surgery to remove the tumor and sometimes chemotherapy to destroy the metastasis. As you already know, there are all sorts of negatives with chemotherapy, and dogs suffer during their remaining life. Ivermectin is an alternative that does not cause all of those negative side effects. It works by inhibiting the growth of new cancer cells by several means, one of which is stopping the cell cycle, and another is interfering with the signaling pattern that tumors use to grow. Besides stopping cancer cell growth, some new research has shown that Ivermectin also creates an environment in which tumor cells are less likely to survive. In this study, the researchers decided that it was also cytotoxic. Dosing Ivermectin for cancer. If you want to try this alternative therapy, giving Ivermectin for your dog's cancer can be done at home. The dose of Ivermectin to treat your dog for cancer is given orally, just like the monthly heartworm preventative, and it does not need to be injected. The toxic dose of Ivermectin is quite high, about 2 mg per kilogram of body weight, and although you can give the 1% cattle solution, available at your local feed store, I would still recommend you purchase the sheep formula if you have a tiny or small dog, since it is more dilute and does not taste as bad. If you have a medium-sized or large dog, you can use the cattle formula, but never use the horse paste as it is too strong for most dogs, and a small dose cannot be given accurately. In some rodent studies, the amount of Ivermectin used effectively is quite high, about 5 mg per kilogram of body weight, but when used on humans or dogs, those doses are a lot lower, and they can be used safely. The most common canine dose that has been recommended by many of the veterinary researchers is 200 micrograms per kilogram of body weight. There are 800 micrograms in each milliliter of the sheep Drench, so since the dose is 200 micrograms per kilogram, a dog needs 0.25 milliliters per kilogram of body weight. See the chart for dosing guidelines based on body weight. If you have a Maltese, for example, and he only weighs 6.5 pounds, about 3 kilos, he should be getting 600 micrograms, or about 0.75 cubic centimeters of the sheep oral formula. I recommend that you use a tuberculin syringe to get an accurate dose for a small dog, but a regular larger syringe is okay for a larger pet. Frequency. The researchers who have used Ivermectin to treat mammary cancer in dogs have not published their frequency dose, but since Ivermectin has been used every day for at least 2 months in dogs with generalized Demodex mange, we know that it can be used safely every day for at least that long. Since the half-life of Ivermectin in 2 days in dogs, however, I recommend it only be given every other day so the amount will not build up to dangerous levels. After 3 months, dogs can be given a rest of 15 days before resuming therapy. If you are using this solution, it is much easier to put this on a piece of kibble, bread, or some other food the dog likes and let him eat that instead. If you are using the sheep Drench formula, it does not taste as bad, at least according to my dogs, and you should be able to give it without disguising it in kibble or bread. There are dogs that have a genetic sensitivity to Ivermectin, so if you have not been able to give Ivermectin in the past, this drug could cause problems. If you decide later on that you want to treat your dog with conventional therapy, there is also some evidence that Ivermectin will work with some of the normal chemotherapy drugs. Ivermectin is probably also useful in a lot of other types of cancer in dogs, but we need more research to prove how useful it is. In people, we already know that ivermectin is effective against breast cancer, colon cancer, ovarian cancer, skin cancer, melanoma, and leukemia. If you are going to use ivermectin to treat her cancer, be sure to change her diet too. Note, when your dog is taking ivermectin for cancer, you no longer need to give a heartworm preventative. The medication for the cancer will prevent heartworms too. I will copy and paste the dosage chart I made up in the comments to make it a little simpler to find it. Thanks for watching. If you have any questions about this alternative treatment for cancer, please let me know in the comments. If this video was helpful, please give it a like. If you appreciated this information and want to learn more about dogs, please subscribe to this channel. If you have any other questions about your dog, you can contact me at my Ask a Vet column at Your Pets at Home.